Hi, my name is Radiya Amin, and my presentation is going to be on cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is a genetic, life-threatening disorder that affects the lungs and the digestive system. It affects the cells that produce mucus, sweat, and digestive juices. It causes these fluids to become thick and sticky. This can plug up tubes, ducts, and the passageways of the lungs. It causes constant lung infections and limits the capability to breathe over time. Here are my signs and symptoms. I have frequent respiratory infections, difficulty breathing, poor digestion and food absorption, salty tasting skin, and persistent coughing. And on this picture right here, this is an image of a healthy lung, and the other is a lung affected by CF. And here are the causes of cystic fibrosis. So CF is actually caused by a faulty gene called the Cystic Fibrosis Transmembrane Conductance Regulator, CFTR for short. The gene makes a protein that controls how salt and water move in and out of our cells in the body. The defective gene that causes this disease is inherited from both parents. People with only one copy of the defective gene are called carriers, but they do not have the disease. Each time two carriers have a child, the chances are 25% that the child will have cystic fibrosis, 50% that the child will be a carrier but will not have cystic fibrosis, and 25% that the child will not be a carrier and will not have cystic fibrosis. This is the pathophysiology of cystic fibrosis. So when a protein's not working correctly, it's unable to help move chloride to the cell surface, and without the chloride to attract water to the cell surface, the mucus in various organs become thick and sticky. In the lungs, the mucus clogs the airways and traps germs like bacteria, leading to infections, inflammation, respiratory failure, and other complications. Here is a chart of cystic fibrosis pathophysiology, and as you can see, it will lead to mucus obstruction, infection, and inflammation. I also have an image of the pathophysiology of cystic fibrosis. So as you can see, this is a normal airway. It's a thin layer of mucus. It coats the airway wall. And then, as you can see here, the airway affected by cystic fibrosis has blood and mucus. It's thick, it's sticky, and blocks the airways. It's a dilated airway, and it's actually bacterial infection already started here. So for diagnosis and lab testing, diagnosis is often a combination of complete clinical evaluation, so genetic testing and a sweat chloride test. Most children are screened for CF at birth since it is a genetic disease. They're screened through the newborn screening test, and genetic testing can be done either during pregnancy or it can be after birth to diagnose CF. So here's prevention for cystic fibrosis. Testing is the best prevention because it is a genetic disease. So you or your partner both may choose to have genetic testing before having children. If anyone in your family, any relative or someone close to you has cystic fibrosis, you may choose to have that testing done as a precaution. It is the best prevention. The test is performed in a lab based on blood sample, and it can help determine your risk of having a child with cystic fibrosis. Here are the treatments and medications. So because this is a genetic disease and multiple other factors, there actually is no cure currently for cystic fibrosis. The treatment can manage the symptom of the disease and it can improve the quality of life, but again, there is no cure. So I have listed the medicines to manage CF, which are antibiotics that will prevent lung infections. In the future, mucus thinning drugs such as hypertonic saline to help you cough up the mucus so it's not plugging up your airways or your lungs or anything like that. And then bronchodilators that can help keep your airways open and relax the muscles around your bronchial tubes. And this is my conclusion to my presentation on cystic fibrosis. Cystic fibrosis is an inherited lung disease. It has no cure, but it does have treatments to manage all of the symptoms. Getting diagnosed early is definitely key, and so is learning if you are a carrier before having children. And these are my references. Thank you.